Hello, my name is Gabriel Alul and I will be bringing you these TheSynapse videos, bringing content that matters to busy medical professionals. TheSynapse has always catered to provide information to you, the busy medical professional, and through these videos we will be giving you a snapshot of what is going on here in Malta with regards to the medical field. For this first video we have with us Professor Joseph Pace, who is taking care of the International Union for Prevention of Sexually Transmitted Infections and who took care of the organization of an annual congress held here in Malta between the 18th and the 20th of September. So, Prof Pace, what can you tell us about this congress?
Well, first of all, I happen to be the chairman of this year's congress, which was organized in Malta. I'm not in charge of the European IUSTI at all. And we had this very successful congress between the 18th and the 20th of September. We attracted almost 400 participants when the average in previous meetings was about 300. And this was the 28th meeting. And they came from 43 different countries. And judging by the letters we received afterwards, and your own feeling after a meeting like this, it seems to have gone very successfully. Why did we bring it to Malta?
That's what I was going to ask, in fact.
It's a long story. But basically, IUSTI had been in Malta, was previously in the time of Dr. Joseph Pace, God bless his soul, which is about 50 years ago. And the meeting is before my time. It was held at the Corinthia Hotel in Attard. Since then, IUSTI has grown. It is a world society with a European section. And every section has its annual congress. The previous one was in Antalya in Turkey 2 years ago. The next two will be in Barcelona and Budapest. And we won this meeting against strong competition from Barcelona and Budapest. No easy task. And when one goes for a conference like this, one has to suggest a main topic for the meeting. I mean, why do you want to do it in Malta? And the first thing that came to mind, in fact, it was something which made us bid for the conference, is the relation of sexual health in general and infection with regard to migrants particularly from sub-Saharan Africa, for the connotations with HIV, but not only, and also those who might come for shorter periods from other parts of Europe and adjacent to Europe, where again HIV rates and sexual infections have really shot up in the past few years. Our migrants come from sub-Saharan Africa, which is really the hotbed of HIV, where about 80% of the world's HIV infections are found. And these unfortunate friends of ours, citizens without passports, call them what you will, are not offered decent healthcare in their country. When they pass through countries of transit, even worse today than in the past when it was pretty bad to start with, not only were they not treated or offered any treatment, they were abused many times. And eventually they come and think they find the promised land. And it's been a matter of concern to me and my colleagues that it appears that these people are neither asked for or indeed even offered any testing or advice against the common worrying sexual infections, particularly HIV.
Now, since you've highlighted the fact that we don't actually have a screening test, what repercussions will this have on their health and on the local community?
Well, it's not, let's make a point, it's not only us. No, in fact, we did just before the meeting started, so it's recent information. We did a survey among all the European countries, basically, who are members, board members with IUSTI Europe. And we asked them, firstly, if immigrants, legal or illegal, with passports or without, are offered healthcare on an equal basis to the local population. And invariably everybody said yes. But then when we asked if these immigrants are offered, or whether it is even mandatory sometimes, a test, a chest x-ray, for example, or more specifically tests against HIV, syphilis and hepatitis, which are rampant now and often coexist in the same immunosuppressed patient. The very worrying result was that about only 2 or 3 countries want a request a test in a mandatory way. And remember, it is something for which there is treatment now, it's just a curiosity. But the great majority, including all the frontline Mediterranean states, neither have a mandatory request or neither do they even offer the possibility to the migrant. Now, WHO, European Centre for Disease Control, EU and all the organisations have expressed their concern about this situation repeatedly over many years, with a number of declarations from different parts of Europe, Lisbon, Bremen, Porto, whatever.
And what did they lead to?
And again, they saw the deficiency is that, one, there is no collation of good information, of good data. There is no exchange of data between the authorities of the frontline states and indeed all the European states, because many of these migrants will end up in other countries in Europe. Neither in most countries are they offered any treatment, as we said. And all these important health organizations make the point that, one, it is the human right of the migrants to be treated properly, including prevention, but also they make the pragmatic point that in treating them, you are in fact preventing disease which will eventually, with certainty, move into the local population. So armed with this information of past suggestions and recommendations, and we had one of the major sessions, particularly on this topic, we had taking part authorities from Dermatology and Venereology. We had people from the EU Migrants Office in Malta, a lady who unfortunately whose name I can't remember, but she replaced Robert Visser, who was the chairman of it, who could not be with us at that time. And we had also an EU Member of Parliament, Roberta Metsola, who sits on the Migration Committee of the EU. We had with us an Italian professor, Professor Morrone, who is in fact the authority on the subject, of the world authority. He is in charge of the Italian health effort for migrants, both at sea and on land. He is one of the top advisors to the current Minister of Health, and he is also my near equivalent to a saint, because if Italy is a bit quiet, he's always doing the same thing in Syria, Iraq, and all sorts of godforsaken places, at risk to his health. He again gave a very moving lecture. The end of it all was, we all agreed that the way forward is to have sharing of information, collecting information, sharing of information between the professional people who take care of these migrants in different countries, the professionals again agreeing, let's call it a quality of care document, a quality of best care document, and then somehow we need the necessary resources, human and financial, to effect this. This is not rediscovering the wheel. This is in fact purely repeating what the various official declarations from above have said for at least for the last 10 years, and now we're saying, guys, it's time to act. It's time to start delivering, because people may be suffering, and this may be going quietly under the radar, unabated.
So you mentioned a number of things which you want to get over and done with here in an European region. Mm-hmm. But how did this Congress actually consolidate what you've just said?
Well, following the experience of this very important session in the meeting, was one of the core sessions. In fact, we called the meeting, our title was Migration, Recreation and Sexual Health. Migration from Africa, recreation, the Maltese, the tourists, those who come for a short happy time, all of us together. And with general agreement, we put a motion forward at the General Assembly of IUSTI, which I proposed, and it was seconded by the President of the British Association. Again, I can read it off, but basically it's agreeing with what has been said repeatedly, updating them with the fact that according to the most recent survey, which was mine 1 month ago, no action has been forthcoming, possibly for difficulty with resources, both financial and human. And we are saying, look, we need to do this, and we are appealing to the EU Health Commissioner and to the EU Commissioner for Migrants to see what they can do in this regard. I understand it's possible that questions will be asked, or the subject will be brought up in the European Parliament, not only by our Euro MP, but by others from neighbouring countries. And there is also an initiative to have possibly a press conference in Brussels later on this matter,
so that is how
with all the key people concerned.
That is how this Declaration of Malta, what did you call it?
This is how we are trying to bring it to the attention of the authorities, because at the end of the day, however much I and you like it, if we don't get action from high above, then unfortunately the situation will only deteriorate.
And similar declarations were already done. So
yes, but they were done by the lawmakers and the lawgivers. They were never done by those in the front line. Seeing these people, seeing people get disease which is preventable, possibly seeing it in your fellow countrymen when it would have been preventable. That hasn't been done.
As an offshot, the fact that migrants are confined in an area for a certain period of time, what do you think about that? How does that affect the scenario?
Well, with any infectious disease, in fact, that's why we had sanatoria once, and that's why Fidel Castro once decided, when all his African health workers in Africa caught HIV, to close them all up, which isn't a good idea either, close them all up in a beautiful palace, basically with everything they want, lock the door, throw away the keys. But the idea of segregating the infected from the infected is a basic thing. Now, what's been going on when we put these people into whatever you want to call it, we keep them away from the population. We're putting those from countries with a high rate of HIV, for example, often unknowing to the migrants. They're not doing it on their own, unknowing, they may have it. Mm-hmm. With others from countries with a low prevalence, and if you mix human beings together for a year and they can't get out, it's quite possible, possibly even probable, that the rate is going to increase.
And then when they are introduced.
On these grounds, there may be others which are political or social, but on these health grounds, it is not a very good idea. Because these are people that's called with a latent infection, if you like, but which is transmissible. They wouldn't have the symptoms, they themselves don't know about it.
That is why something needs to be done. So, with regards to the other things which were discussed in the program, what can you tell us?
The program was a very vast one. The other main sort of topics, if you like, well, we started off with an interesting history session, by the way, because history is an important part of medicine. The past teaches us the future. And we had a lot of Maltese contributors. We had Charles Bonaventura, who spoke in the history session on sex in the city of Valletta in the Middle Ages, which was a very interesting and entertaining talk. We had others giving scientific contributions. We had, I hope I don't forget anybody, but we had Charles Maria Zoppardi, who spoke on leishmaniasis as a co-disease with HIV, which was of great interest to the audience, especially those who care for HIV patients. We had Michael Boffa, who spoke about genital dermatosis, again of great interest, especially to the British, who are either venereologists or dermatologists, unlike Europe, where they are both. We had a session which was very interesting, run by our non-doctor, but healthcare personnel, Marika Podda-Connor in particular. She was the chair of a session on female genital mutilation. And we had others. We had Dr. Camilleri from the Jesuit Center, and we had Maria Pisani speaking there. Okay. And we also had Dr. Chris Fenn, who, as you know, has proposed, I'm not sure, I think it's possibly passed a legal position on prevention of FGM in Malta, and I must congratulate him for speaking very well on this one. So there were in fact 60 Maltese registrants, which is pretty good.
Out of a total
of 370.
Yes,
so, it was very, very respectable, and I think we put on a good show. And I think we got a lot of pluses for this meeting. We helped Malta to some degree consolidate its place as a conference centre for the smaller or medium-sized conferences. Both the exhibitors and the registrants were very pleased with the arrangements. They were full of praise for them. And I think at the end we managed to make them honorary ambassadors for Malta and Maltese medicine, if you like. Besides that, alongside, we also managed to get our experts, once they're here we have to use them, in fact to use some others, to run a basic course on management of STIs. Because we've perceived for a long time, we've had one venereologist who has worked heroically for many years, I must say, often starting his work at 7 o'clock in the morning when the rest of us are starting to think about their first cup of coffee or still asleep. But certainly there's been a lack of human manpower and of knowledge. So we found that BASHH, which is the British Association, have a tailored number of courses delivered by experts at different levels. And basically they'll tell you what to do and what not to do. And we had a course with 50 registrants, which was the maximum 3 trainers will take. They're very rich on this. It was fully sponsored by Dr. Charmaine's Gauchi Department of Health Information. I have to thank her for this, and the ministry were excellent. And in addition, they also sponsored an e-course, an online course, both for those who took part in the actual course at the meeting and for others who were unsuccessful but were nevertheless interested. And I think, again, that went well. Finally, I'm pleased to say that the trainers, when they gave their reports, said this was the best group they ever had. So I think we're getting there. Now we want to increase the interest by having a second level course, possibly next year, and repeat the first one for those who are successful. With the influx of people into Malta from all sides, it's imperative we have first-line knowledgeable people at all areas, in the airport, at the polyclinics and family practices, in the hospitals. Otherwise we're going to keep missing things, or even worse, fill people full of antibiotics without reason, without cause, ending up with wrong diagnosis. So we'll also have to make available the various tests to people outside the hospital, provided they have shown they have the appropriate knowledge and information to use them properly.
So, Prof Sparch, in a nutshell, the final comment or your final message to those medical professionals out there who are watching this show and who have an interest in what we've just discussed.
Okay, sexual health, sexually transmitted infection is not glamorous, but it's increasing mightily in every country in the world and every corner of Europe. In some countries more than others. To know it is to be able to recognize it and to treat it. Not to know it, not to plan enough, not to have the appropriate human and financial resources, is simply to cause disaster. And when there's a grenade, somebody takes the pin out, it will blow up sooner or later. So let's make sure we know where the pins are and that they stay right in place. Thank you very much.
Thank you, Prof Sparch, for your time and patience, and thank you all who have followed this program, this show. I invite you to like the Facebook page, TheSynapse, and to follow us on thesynapse.net. Thank you.